Hello guys, welcome back to my YouTube channel. So today we'll be talking about something very serious. If you are a mother, if you have toddlers, you need to watch this video. The video is steam inhalation, helpful or hazardous? Imagine that you're trying to steam your baby to clear their airways, and before you know, you're running kitty kata to the hospital because of Alright, my name is Dr. Linda, and on this channel I share videos related to health, to motherhood, to lifestyle, to career, and to my all-time favorite hobby, which is DIY. So guys, today let's delve into this topic. At the end of this video, you will be able to make an informed decision as regards steam inhalation. When next you go to the hospital and you're told about steam inhalation, you will know really what you have been asked to do, why you're supposed to do it, the benefits it could bring, and what you could do better about the process of steam inhalation. Alright, so let's get into this topic. Steam inhalation is simply breathing in steam from heated water, okay? And this is something that could be done to get some symptomatic relief from a cold or a flu or an upper respiratory tract infection. Usually it's an add-on therapy. It doesn't necessarily take care of the cause itself. If this flu or cold obviously is from a viral cause, it will resolve on its own because it's self-limiting. But there are things that your doctor could ask you to do to get you some symptomatic relief, and that is where steam inhalation comes in. It's an add-on therapy. Now if it is bacterial, you'll probably be given some antibiotics by your doctor, but they could still ask you to do steam inhalation because it's going to help you get some symptomatic relief. For instance, if the cough is dry, it could help soothe your throat. If you're having a dry throat, it can also help soothe that. If you're having nasal congestion, it can also help you open up your airways. So that is basically why this whole process of steam inhalation is often prescribed by certain doctors or practiced by some people. Now, how is this done? This is done in different ways depending on the age group. For adults, you can simply put the heated water in a bowl, bend your head over, cover with a towel, and then inhale the steam for about 10 to 15 minutes. For children, toddlers, pediatric age group, you can go on, put a bowl of water, stay by the side of that bowl of water with the child, and then you cover with a duvet, and then you can inhale that for about 10 to 15 minutes with breaks in between. Okay, so guys, this whole process, is it helpful or is it hazardous? You've seen all the benefits I explained, so you can agree that to some extent maybe this whole thing is helpful. Now there have been researches and evidences to show that this can actually be helpful and has gotten symptomatic relief. They seem to have been getting results that this is helpful, but there's still a gray area when it comes to the field of science, because there are still some school of thoughts that do not, from the scientific studies they've done, there is not sufficient evidence to show that steam inhalation actually gets rid of these symptoms. Okay, so it depends on the school of thought that is responsible for that management of your child. Okay, now that being said, people still say that when they do steam inhalation that they get benefits and they have their airways cleared. And as a result of that, and on that side of the evidence, it is something that is occasionally prescribed in hospitals. That is to say, you can go to the hospital and your doctor will actually tell you to do steam inhalation, right? Okay, now on the other side, a series of studies that have been done that have tried to weigh the pros and cons of steam inhalation. Studies have shown that steam inhalation is directly linked with scald burns in the pediatric age group, and that is a very serious problem because the socioeconomic impact, that is the financial impact and the time factor impact and the health hazard that children are exposed to when doing steam inhalation, is way more than the benefits of clearing that nasal congestion, for instance. So they have shown that children who parents who try to do that with their children are at risk of probably tilting that hot water bucket over and then getting the child burns. And when that happens, it's a totally different story. Imagine that you're trying to steam your baby to clear their airways, and before you know, you're running kitty kata to the hospital because of a hot water burn. And you know that's going to, it's not just something that you could treat on the outpatient basis. It could require admission, and that's going to cost money, both for either your pocket if you're paying out of pocket, or for the insurance company if you're being funded by insurance. And even manpower is being consumed by, as the doctors will have to attend to the child as well as the nurses during that time period, because burn in children is not the same as burn in adults. It could get a little more complicated as their surface area is smaller and their immune system might not be as strong. So guys, you can see where this becomes dicey. Ordinary cough and catarrh leading you to admission in the hospital for some time. That is something that nobody plans for. So some studies have weighed all of this, and on that basis they think that steam inhalation is not the way to go. Now what I'm trying to do here is help you make an informed decision, and if you still insist that you want to do steam inhalation, then you have to make sure that you are careful to avoid those mistakes that can occur, which is the most feared complication of steam inhalation: scalds or burns. Number one thing I think you can do is make sure that when you're doing this, you're not doing it alone. Especially when you're dealing with the pediatric age group and you have to cover your head with a duvet, make sure someone else is responsible for covering and uncovering you during that process, so that you can focus on keeping the child's hands and legs together, because usually it's the hand kicking and the leg struggling that they'll be doing during that time period that can kick the bucket over and lead to that burn. So if you want to do this, then you have to make sure that you are able to control your child's movements, number one, that somebody else is there to assist you, number two, and then you try as much as possible to keep the bucket away from you to an extent, okay, while still under the duvet. And lastly, the person who is assisting you has to be careful not to get this water all over you when uncovering. Let the duvet not mistakenly push the bucket and tilt it over and then pour on you both, which would be quite disastrous. Now there is another amazing option. Some technological advancements have been made, and there are now steam inhalers that do not require you to have hot water in them. I think that is amazing if you really want to do the steam inhalation process. That way you are not predisposing yourself to hot water burns. So with these few points of mine, I hope I have enlightened you and not confused you about steam inhalation. Is it helpful? If you want to make it helpful, what are the steps you can take additionally to make sure that the hazards do not occur? Alright guys, till next time, I'm Dr. Linda, and please do not forget to subscribe to my channel, because I love your subscriptions coming in, I love your likes coming in, I love your comments coming in. They keep me encouraged to keep posting videos on this platform. Okay, till next time.